Leadership. Now, over 30 short films by and about women will be released today to mark International Women's Day. One of them, After Sicily, focuses on two doctors, a nurse, a nun and a mother, of all of whom have either realised the need for palliative care in their countries or emerged from heart-wrenching personal tragedies to soldier on through setbacks and help the sick die a good death. Well, you can watch some of that now, I believe.
Psychologically is very difficult kind of medicine, and it's very hard for doctors and for me too to every day listen their suffering. It's very hard, but still I do it, because since 2000 I feel not just responsibility to establish it. I feel myself as a mother. And you know, mother never will burn out from your children.
Now, as you can see, there are clips of that movie and some of the tragedies that people suffer. Well, Dr. Odontuya Davaasuren of the University of Mongolia is a pioneer of palliative care in her country. You saw her in that clip. Her efforts have placed Mongolia as one of the leading 35 countries with an integrated program in palliative care. Now, welcome to the program, and congratulations on being featured on this on these films. Now, tell us, how did you get started in palliative care?
Before 2000, we in Mongolia had no any palliative care services. Our medical schools had no program on palliative care education. Mongolia had no drugs, affordable drugs for pain management, and Ministry of Health had no policy on palliative care. And first time, by support of Open Society Institute in 2000, I had occasion to participate in the European Association, Palliative Care Association Congress, and it was very new for me. I had some experience of death in my life. My parents died when I was a very young person, and when I saw this very interesting part of medicine, I really want to establish it. When I came back to home, I visited with my students the patients' home, incurable patients' home, and visited from one home to others. And one day, watching this problem in these families was for me enough to make hard decision to establish palliative care in Mongolia, because I saw so many suffering, not just physical pain. I saw many psychological, spiritual, social, financial problems.
Now, as you say, deep tragedies there. We know that in developing countries, most health systems are overstretched anyway. They're trying to cure the sick. So how challenging is it to then create a program to help the incurable who are terminally ill?
Yes, you are right. Even when I started, some health policy makers told me, we have no money for living patients, why we need to spend money for dying patients? It was very challenging to provide advocacy to policy makers and provide awarenesses between population about human rights to be even in incurable stage to receive palliative care. Palliative care, it's the total care for improving quality of life of patients and family.
All right, and I hope you do more such good work. Thank you for joining us, Dr. Odontuya Davaasuren.
Thank you.